When you're struggling with an acute injury, the advice used to be to stick an ice pack on it. But actually, recent research has shown that ice or cold therapy isn't actually as good for acute injuries as we used to think. So what we know now is that the inflammation and the soft tissue swelling that often accompanies an injury, say you've rolled your ankle and it's ballooned up to twice the size, that inflammation or swelling within the joint is actually a normal and quite important part of the recovery process. So say you've got an ankle injury, the advice used to be rest, ice, compression and elevation. That was the acronym, the RICE acronym. We've moved away from that now, and the acronym that we should be using is peace and love. So the P stands for protect. So in the first 2 to 3 days, what you want to do is offload that joint. So whether that is resting it, using a sling, using some crutches, you're just going to minimize the chance of aggravating any injury any further. E stands for elevate. So if possible, elevating the injured part of your body above the level of your heart. A stands for avoid anti-inflammatories. So paracetamol, okay for pain relief. Ibuprofen, not so great. Non-steroidal anti-inflammatories, they're not as effective as pain relievers. They also delay healing at a cellular level, so it can mean that you take slightly longer to recover from that injury. The C stands for compress, so whether that's using a brace, a tape, some sort of compression garment or something like that, and that can just reduce any kind of bleeding in the local tissues and also help in a natural way to just drive out swelling. And then the E stands for education. So after those first 2 to 3 days where you've been protecting and offloading the joint, you want to speak to some kind of health professional and make sure that you've got a plan in place to help with your recovery after those 2 to 3 days of rest. So then you move into the LOVE acronym. So L stands for load. So whether that is using some kind of resistance bands, some kind of resistance training, or any kind of strengthening, we want to be loading the joints, and the research supports the fact that adding some kind of load, making the joints work, is effective in promoting recovery. O stands for keeping optimistic. Of course, really important if this is something that happens to you a lot, if you're training for an event. We know that our brain has a huge impact on how well we recover from injuries, so staying optimistic about your recovery is really important. V is for vascularization, so a fancy way of saying let's get a lot of blood flow into that area. So using and working the joint, soft tissue techniques, anything like that that can help promote blood flow, because blood flow into an area brings oxygenated blood, it brings good nutrients, it helps clear the lymphatic system as well. It can help promote lymphatic drainage and removal of that swelling. And then the last E stands for exercise. So some kind of graded exercise plan to get you back, putting that joint through its paces, making sure that you're reducing the risk of further injury, that you're incorporating some kind of stability exercises into what you're doing to help ensure that this doesn't happen again. So avoid ice, let the joint do what it needs to do with that swelling and inflammation, and focus on peace and love.